What are the potential complications of untreated sleep apnea in Angelman syndrome? Have you ever wondered how untreated sleep apnea can affect individuals with Angelman syndrome? This condition can lead to several serious complications, particularly when sleep apnea goes unaddressed. Let's break down what can happen. Sleep apnea causes repeated interruptions in breathing during sleep. For individuals with Angelman syndrome, this can worsen existing sleep issues. Many already struggle with falling asleep, staying asleep, and achieving restorative sleep. When sleep apnea is present, these problems can become even more pronounced. First, untreated sleep apnea can lead to worsening sleep quality. Frequent breathing interruptions disrupt the natural sleep cycle, reducing the time spent in deep non-rapid eye movement and rapid eye movement sleep. This fragmentation can exacerbate cognitive and behavioral challenges, making it harder for individuals to focus and learn. Next, there is an increased risk of respiratory problems. Individuals with Angelman syndrome often have muscle tone issues and swallowing difficulties. These factors can impair lung function. Sleep apnea can further reduce oxygen levels during sleep, raising the risk of respiratory infections such as bronchitis or pneumonia. These infections can lead to hospital stays, which can be particularly concerning for those with Angelman syndrome. Another complication is the potential for exacerbated seizures. Seizures are common in Angelman syndrome, typically starting in early childhood. Sleep apnea can cause low oxygen levels and sleep disruptions, both of which may trigger or worsen seizure activity. This makes managing seizures even more challenging for caregivers. Untreated sleep apnea can also impair daytime functioning and behavior. Poor sleep can lead to increased daytime sleepiness, irritability, and hyperactivity. These issues can complicate communication and learning, affecting the overall quality of life for both the individual and their caregivers. Lastly, there may be cardiovascular strain. While research is still ongoing, untreated sleep apnea can increase cardiovascular risks. This happens due to repeated drops in oxygen levels and increased activity of the sympathetic nervous system during sleep. Over time, this may lead to higher blood pressure and strain on the heart. Given these potential complications, it is vital to recognize and treat sleep apnea in individuals with Angelman syndrome. Early diagnosis and interventions, such as continuous positive airway pressure devices, can improve sleep quality and reduce respiratory complications. Addressing sleep apnea can also ease the caregiving burden and enhance overall well-being. Monitoring for sleep-disordered breathing should be a routine part of care for those with Angelman syndrome, due to their increased vulnerability to these complications.